My name is Michael Levy. I'm the CEO and founder of a company, Work Proud. And I've brought some pretty clever people who will give you a lot more information. Casey and Zach are people that Zach's somebody that I've worked with for many years. Casey's somebody I hope to work with, but has certainly some perspectives and expertise around this topic of, engagement.
So my name is Casey Conway. I'm a senior program coordinator at UT Southwestern Medical Center. So I started there actually in internal communications and then moved more into employee recognition. And then as we have kind of grown within employee engagement, I handle the programs and communications for that now.
Hi, so I'm Zach Lipner. Before I even get started, Robin, I got to recognize your organization who cared for my mother in her last days about a decade ago. So a little recognition over there for you.
Thank you.
Your organization, something that I've remembered in the back of my mind. So I was the Chief Human Resource Officer at Newark Beth Israel Medical Center, which is a quaternary care, major teaching, cardiac, transplant, Children's Hospital of New Jersey, urban medical center located in Newark, New Jersey, which was really to some degree, the epicenter of the initial COVID outbreak. I found that there was a whole bunch of word going around the organization around what was going on, and really a lot of fear. Staff was just petrified. Doctors were petrified. But in my conversations, I felt they were up for the moment. But none of us had any idea what that moment was going to look like. We had pediatricians taking care of adult patients, residents doing things that they were not maybe quite ready to do yet. But nobody knew what to do anyway. So it was really one of the most intense moments of my life, and nothing.
Actually, the next thing we're going to talk about more specifically is the impact of COVID-19 on employee engagement. So our annual survey is actually in the summer. So we were able to kind of hit that survey right in the middle of COVID and see what was going on with engagement, and we're actually pleasantly surprised that engagement was up 4 points.
But I felt that employee engagement improved dramatically, and I think that there are a couple of reasons for that. I think one is the focus on mission, and I know we use Press Ganey for our employee engagement surveys, and they drive mission as attachment to mission is one of the highest drivers of employee engagement. Yet what did we do before COVID? We talked to employees about safety. We talked about financial performance. We talked about building volume. We talk about customer service. None of that really goes to mission. But when you're caring for patients and every night the fire department drives by and blows their horns and people are out on balconies banging pots and pans and, again, the food, it brings people back to why they got into healthcare in the first place. One thing happened that was particularly interesting during this period was not only did we see more employee recognition from managers, but our peer-to-peer recognitions on our platform jumped up tremendously.
Look, this is no longer a piece of equipment. This is now a window that is a communications vehicle. How are you as HR professionals leveraging, depending upon your industry type, that window to them to communicate these messages? And
I think that for years we battled against this, right? When it first showed up in the workplace, these mobile devices, but people are going on them anyway. So somehow we can get them to go on them during working hours for work-related stuff as opposed to Amazon. This becomes a powerful tool for us to communicate, to recognize, to train, and people will go there because they're already trained to do it. That's what they do in their spare time.